The kidneys are one of the organs that can decline quietly for a very long time. Before a person fully realizes that something is wrong, that is exactly why kidney health deserves more attention, especially for older adults. Many people think of the kidneys only as organs that make urine, but their role is much bigger than that. They help filter waste from the blood, balance water and minerals, support blood pressure control, contribute to red blood cell production, and influence bone health through complex body regulation. When kidney function begins to weaken, the problem does not stay inside the urinary system. It gradually affects the entire body. The difficulty is that the early signals are often subtle, vague, and easy to dismiss. A little swelling in the morning, slightly foamy urine, fatigue that feels heavier than usual, a loss of appetite, a blood pressure pattern that has become more unstable, or a sense that the body is not recovering well after ordinary days may all seem unrelated at first. But when these changes begin to repeat, they can point to a larger problem that should not be ignored. One of the most common worries is foamy urine. Many people become alarmed the moment they notice bubbles in the toilet, and immediately assume that the kidneys have failed, or that diabetes has suddenly appeared. But a single episode of foamy urine does not automatically mean disease. Urine can foam more when it is concentrated, when a person has not had enough fluids, or when the stream is simply stronger and faster than usual. What matters more than a single moment is the pattern. If the foam appears repeatedly, lasts longer than before, and comes with other changes such as swelling, fatigue, rising blood pressure, reduced appetite, or changes in urination, then that combination deserves medical evaluation. The kidneys are remarkable because they work continuously and silently. Day after day, they manage the body's internal balance, without asking for attention, but modern life places a heavy burden on them. Meals are often too large, too fast, too late, too salty, too sweet, and too processed. Many people also live with chronic stress, poor sleep, low activity, and frequent exposure to convenience foods. These habits do not only affect weight or digestion, they also influence blood sugar, blood pressure, and vascular health, all of which are directly connected to kidney function. This is one reason kidney disease often develops alongside diabetes and high blood pressure. In fact, unstable blood sugar is one of the most important long-term stresses on the kidneys. Even people who have not been diagnosed with diabetes can still experience repeated spikes in blood sugar. If they eat quickly, snack constantly, rely on refined carbohydrates, drink sweet beverages, and end the day with late-night meals. Each spike may feel harmless in the moment, but over time the body pays a price. Blood vessels become stressed, insulin regulation becomes less efficient, and the organs that depend on stable circulation, including the kidneys, become more vulnerable. That is why kidney protection begins long before a formal diagnosis. It begins with understanding how everyday habits shape the body's internal workload. Another problem is that many people normalize warning signs. Morning puffiness is seen as part of aging. Evening leg swelling is blamed on being on one's feet. Heavy fatigue is explained away as stress. Reduced appetite is called temporary. Frequent urination at night is accepted as normal. But when several of these changes appear together and remain for weeks or months, they should not simply be folded into the idea of getting older. Aging changes the body, yes, but not every decline should be treated as inevitable. The body still sends information. The goal is to notice it before it becomes severe. Fatigue deserves special attention here. Not all tiredness is the same. There is the ordinary tiredness of a busy day, and then there is a deeper, heavier fatigue that does not improve much with sleep or rest. Some people describe it as feeling drained from the inside, unable to recover fully or unable to think and move with the same steadiness as before. When kidney function weakens, fatigue may come not only from the buildup of waste products, but also from related issues such as anemia and disturbed mineral balance. This is why persistent fatigue should be taken seriously when it is paired with swelling, appetite, changes in urination. Swelling is another meaningful signal. The body depends on the kidneys to help maintain fluid balance. When that control becomes less effective, puffiness around the eyes in the morning, sock marks that stay on the legs in the evening, swelling in the hands, or a general sense of fluid heaviness can start to appear. Of course, swelling can also have other causes, including heart issues, medications, long periods of sitting, or very salty meals. But recurring swelling should always be treated as useful information, rather than something to shrug off. Blood pressure may also become harder to control. The kidneys and blood pressure are deeply linked. When one is strained, the other often becomes more unstable. A person may find that medications no longer seem as effective, or that readings are rising without an obvious reason. This does not always mean kidney disease, but it does mean a broader check is warranted. Because the kidneys participate in multiple body systems, problems may show up in places that do not seem directly related. Some people notice shortness of breath during mild activity. Because of anemia or fluid shifts, some experience nausea, poor appetite, or a metallic taste in the mouth as waste handling changes. Others begin to feel that their skin is drier, more irritated or itchier than before. In advanced situations, the whole body can seem less resilient. The person may eat less, move less, and recover less. That is why it is a mistake to view the kidneys as a narrow urinary topic. They are central regulators in daily health. Medication use is another area that deserves careful thought. Medicines are often necessary and extremely helpful, and no one should stop prescribed treatments without medical guidance. But at the same time, older adults often underestimate how common long-term medication burden can be. Pain relievers are a good example. They can be useful when used properly, yet frequent and prolonged unsupervised use may strain the kidneys in some people. The same is true for the habit of adding multiple supplements, herbal products, and over-the-counter remedies without a clear reason. More is not always better. When the body is already working hard to process many compounds, extra layers of self-medication can make the picture harder to understand, and sometimes harder to tolerate. Food choices also require a practical perspective. People often ask which single food is best for the kidneys, but kidney protection is not built on one miracle ingredient. It comes from a pattern: less processed food, less excess salt, less excess sugar, more balanced meals, more predictable eating times, and more restraint in portion size. Meals centered around vegetables, simple proteins, legumes, and less aggressive flavoring tend to create less metabolic chaos. This does not mean that every person should eat the same way. People with diagnosed chronic kidney disease may need individualized adjustments for protein, sodium, potassium, phosphorus, and fluid intake, depending on the stage of disease and associated conditions. That is why generalized healthy eating advice must always be adapted for those with confirmed kidney problems. Still, for the average older adult trying to protect kidney health early, the principle is clear. Reduce overall burden before the body starts losing ground. Meal timing matters too. Large late dinners and habitual midnight snacks leave the body working when it should be shifting toward recovery. Repeated nighttime overload can worsen blood sugar swings, interfere with sleep, encourage weight gain, and increase the next day's fatigue and swelling. Eating fast also matters more than people think. Fast eating often leads to overeating before fullness can register. It also tends to produce sharper rises in blood sugar. Slowing down, chewing well, and putting the spoon down between bites may seem simple, but such changes can alter the body's response to food in meaningful ways. Food order can help as well. Starting with vegetables and protein, then eating starches later and in smaller amounts, may support smoother blood sugar control. This is not a dramatic trick. It is a practical way to reduce sudden metabolic stress. Fruit is another area where many people become confused. Fruit can absolutely fit into a healthy diet, but quantity, form, and timing matter. Whole fruit is generally preferable to juice. Dried fruit and heavily sweetened fruit products can concentrate sugar, far more than people realize. For older adults concerned about blood sugar and kidney protection, fruit is best treated as part of a balanced meal plan, rather than as a limitless health food. The same logic applies to healthy foods in general. Something being natural or traditional does not automatically make it harmless in any quantity. Excess is still excess. The body benefits from what it can process comfortably, not from what overwhelms it, even if the source appears healthy. One of the strongest themes in healthy aging is moderation. Not deprivation, but moderation. The body usually suffers more from chronic excess than from careful simplicity. That includes excess calories, excess seasoning, excess sugar, excess portion size, and excess frequency of eating. In this sense, one of the most kidney-friendly choices is often simply eating a little less and a little more thoughtfully. For many older adults, traditional meal patterns may still offer useful guidance. Simple home-cooked meals with vegetables, legumes, modest portions, and less processed food can be easier on the body than heavily engineered convenience. Foods designed for constant craving. Modern food environments encourage people to keep eating long after. True hunger is gone. The tongue becomes satisfied while the organs become burdened. Over the long term, that burden accumulates. Screening and routine monitoring matter, because kidney decline can progress without obvious pain. Blood tests and urine tests are simple, accessible ways to detect changes. If a person has diabetes, high blood pressure, obesity, cardiovascular disease, a family history of kidney issues, or frequent use of pain medicine, regular monitoring becomes even more important. It is also useful to compare results over time. Rather than reacting only to whether one number is labeled normal or abnormal, trend matters. A gradual worsening may deserve attention even before a crisis develops. There are several practical habits worth reinforcing. Eat a little less than full. Slow down during meals. Cut back on sweet drinks, heavily processed snacks, and very salty foods. Avoid making late-night eating a routine. Stay physically active with regular gentle movement such as walking. Monitor blood pressure and blood sugar when indicated. Pay attention to swelling, changes in urine, and persistent fatigue. Review regular medication use with a clinician or pharmacist when needed. Most of all, stop assuming that small body changes are meaningless. The kidneys do not always shout. Often they whisper through patterns. The goal is not to become fearful of every symptom, but to become observant enough to act early. This is especially important because advanced kidney disease changes daily life in major ways. When kidney function falls too far, treatment becomes more complicated, dietary freedom narrows, energy drops, fluid retention becomes more difficult, and the entire rhythm of life can revolve around disease management. No one wants to discover this late if it could have been slowed earlier. The encouraging part is that prevention and slowing are possible. The body responds to repeated habits. It also responds to repeated care. A person does not need a dramatic reset to begin protecting the kidneys. The beginning is often quiet: one less sugary drink, one smaller dinner, one slower meal, one earlier bedtime, one more walk, one more check of blood pressure, one decision not to ignore swelling again. Health is rarely preserved by a single heroic act. It is preserved by daily restraint and attention. If your body has been giving you hints through foam, swelling, fatigue, appetite changes, or unstable numbers, do not push those signals aside. Listen carefully. The kidneys may be silent, but silence does not mean safety. Often it is simply the stage before consequences become harder to reverse. Start early, live more gently, and let your daily habits become the protection your kidneys need.